Good afternoon, good afternoon. It's September the 27th, 2017. Welcome to the DotBox USA first podcast. We are officially registered as a business in the state of Massachusetts starting yesterday. The DotBox USA, sponsored by IBM and Arrow Electronics. So today, September the 27th, we are taking some questions.
What is the DotBox?
Excellent question. The DotBox is two components. One is a media player streaming since 2015. Streams legal media such as audio, video, and podcasts. It's a very popular item among the DotBox family. I've sold hundreds of units and one return since December of 2015. Thanks for asking.
How do I test a DotBox?
Well, there are two DotBoxes you might be interested in testing. The first is for households and families who prefer to stream media whenever they want, commercial free. The second DotBox is an e-caregiver dedicated to families who have to take care of their loved ones, most likely like the senior population. It gives e-caregiver allows families to communicate with their loved ones in real time without being in the room. It is also set to converse and ask questions and answer questions 1 time, 2 times, or 40 times. It is a friend to the senior. Okay. Here's another question we have.
When did DotBox begin?
DotBox began December of 2015. Most recently, in March of 2017, we're a finalist at the GE Health Hackathon. Then we were accepted into the IBM and Arrow Electronics with Indiegogo to get certified as one of their incubators in their program for 2017. So we have some healthcare questions. Let's get to the good stuff, okay?
Where can I contact you about a DotBox?
So you can always contact me at 617-504-4426, or you can find me at facebook.com DotBoxUSA. That's facebook.com DotBoxUSA. Okay, let's get to the healthcare questions.
I am currently working with no plans to retire, but I will turn 65 soon, and I'm thinking about getting basic Medicare, which is Parts A and B, a Part D drug plan, and a Letter G Medigap plan. My employer plan costs me $160 per month, and I have to cover my copay and some hidden fees, as well as medications. My plan covers about 80% of vision, dental, preventative, and outpatient procedures, as well as an annual mammogram, physical, TB, and flu shots. I am given a $500 card each year to offset some of these out-of-pocket expenses. I take no medicine at this time.
Good.
My first question is, would you advise giving up my employer coverage and replacing it with Medicare A, B, D, and G?
Wow, you are asking all the right questions here, and I know they're the same questions that many other listeners have. My estimates of Watson's Medicare premiums differ a bit from others, but I think you might be better off keeping your employer plan and not getting Medicare. But as I recently said, this can be a close call. It makes a lot of sense to do the kind of care. But as I recently said, this can be a close call, and it makes a lot of sense to do. But as I recently said, this can be a close call, and it makes a lot of sense to do the kind of careful comparison that you're undertaking. Let's go to another question.
As I see it, the money I saved by doing this would cover all these premiums, which would mean all my possible medical expenses would be covered 100%. Is this thought process correct?
Well, in Watson's case, or the lady here, Part B of Medicare will cost at least $134 a month. It has an annual deductible and pays only 80% of covered expenses. Part G, which will cover unpaid Part B expenses, will set you back roughly $100 to $175 a month, depending on where you live. Part D plans aren't free either, and even though monthly premiums average only about $40, annual out-of-pocket maximum spending can reach up to $6,000 or more. While you do not take prescription drugs now, I try to hammer home to people that health insurance is not for the present you, but for the future you. All of us will face a higher prescription drug and other health expenses as we age. Do you have another question?
My other question is, I have had long-term care insurance for 14 years. I have not had occasion to use it, but just received a notice stating future projections require that my policy premiums will increase annually by $655,
That's a
and
lot.
that there could be future increases as well.
Okay.
This is a big blow as the insurance already costs $2,200 annually, which
Right.
is not easy for me to cover.
I understand.
Would you advise dropping the coverage altogether considering the Medicare coverage I will have? And if not, could you direct me to reputable companies I can look into for less costly coverage?
Well, first, let's make it clear that Medicare coverage can change. A policy with a reputable insurance company is a contract that binds you together. This cannot change. As for long-term care insurance, I wouldn't drop it. Medicare does not pay for long-term care. I don't know the terms of your current policy, but I'm afraid that the price you mentioned does not seem unreasonable for an individual policy. Long-term care costs can be very, very high. I suggest contacting your current long-term care carrier and see if they offer cheaper policies. Then decide whether they still provide meaningful protection. Try to find a cheaper policy is difficult though. Many of your insurance carriers do price at your current age and may even charge more than your present carrier. I'd reach out to an insurance broker like Victor or ask them to shop for a new policy and see what's out there. Do you have another question?
I pay late enrollment penalties that add 30% more to my Medicare premiums for the rest of my life. The only reason I signed up late is that I was still covered by my employer health policy.
Okay.
Is there any way out of this? Such a permanent fine for lateness is beyond harsh.
Employers with more than 20 employees are supposed to continue offering group health insurance to active employees even after the employees have turned 65. In this event, mind you, this event requires paperwork. You should not face any enrollment penalties when you later enroll in Medicare, if you have the paperwork. Retiree health insurance, however, does not count as active group insurance. Hope that answers that question. Okay? Do you have another question?
My mother is a retiree, and she gets less than $700 a month for Social Security and less than $700 for her pension plan. She has Medicare, is a cancer survivor, and is battling disabilities. At 83, she needs assistance with keeping up her apartment, cleaning, shopping, and laundry. I was told she is not eligible to receive home health care unless she gives up her pension and Social Security benefits and becomes a state welfare patient. This is very scary for all of us that work and look to retire. What can I do to help my mother?
Having a reputable support team is going to make a big difference. It seems to me that the advice you received was based on the assumption that your mother would need to apply for Medicaid to be eligible to receive insurance payments to cover the kind of in-home care that she needs. Qualifying for Medicaid, in turn, could require her to spend down her assets. Also, you might be able to afford paying for some in-home care out of your own pocket. This is hardly a great solution, but is the best practical choice. Hence, the inception of the DotBox e-Caregiver. Thank you for joining our first podcast, September 27th, 2017.